Potty Training Your Child, presented by the Office of Early Childhood and School Readiness. So remember, for learning to use the toilet, there is no one right or the right age to learn how to use the toilet. Our job today and what we are going to do is share some thoughts for you to keep in mind as you help your child learn to use the toilet. So, one of the important things are to look for signs that your child is ready to be potty trained. So, some of the signs are that your child stays dry for at least 2 hours at a time or after naps. Your child might be copying your parenting toileting behavior. They can follow simple directions. And another thing is that they're developing physical skills that are critical to potty training. The ability to walk, to pull their pants up and down, and to get on or off the potty with some help. Some other signs are that your child is recognizing when they are urinating or having a bowel movement. For example, your child might go into another room or under the table when they have a bowel movement. This is important. If your child does not realize they are having a bowel movement, they won't be successful at potty training. Most important, your child wants to use the potty. They may tell you that they want to wear underpants or want to learn to go potty like mommy and daddy does. And they might be uncomfortable in a soiled diaper and ask to be changed or ask to use the toilet themselves. Some important things to remember when to not start potty training. There are some issues that can sometimes get in the way of successful potty training. For example, when children are going through a significant change or several changes at once, such as an upcoming move, beginning new or changing existing childcare arrangements, switching from the crib to the bed, if there's a new baby coming in, or a major illness, death, or another family crisis. So if that's going on, it might be smart to hold off trying to potty train. At these times, children often are overwhelmed and sometimes lose skills they have already learned or were making progress, possibly like potty training. Common situations that can cause stress are generally not a good time to start potty training. So, one of the things for starting potty training is really to think of it as it's a process in which you and your child have your own jobs to do. So, a parent responsibility. Some parent responsibilities are to create a supportive learning environment. This means that you recognize that your child is in control of his or her own body. Let your child decide whether to use the potty or a diaper or pull up each day. Or teach your child words for body parts such as urine and bowel movements. So those are the parent jobs. Some other parent responsibilities are to offer your child the tools she needs to be successful at toileting, such as having a small potty, a potty seat, a stool, those things. Expect and handle potty accidents without anger. Avoid punishments as well. It's also important not to offer too much praise around toileting. This can make the child feel bad when they aren't successful. So let's talk about the child's responsibility. It is the child's responsibility to decide whether or not to use the toilet or a diaper pull-up. For the child to learn their own body signals for when he or she needs to use the toilet, and allowing them to use the toilet at their own speed. Finding a toilet training method that works for your family is really key. No matter how you do it, remember this is a learning process that takes time, and there are going to be many accidents along the way. Being patient is the best way you can support your child as they learn. Keep in mind that children with special needs may take longer to use the potty. They may also need special equipment and a lot of help and support from you. So, when to avoid potty training? Young children are all about trying to gain some control over the world. They are using their growing physical, thinking, and language skills to gain some power over themselves, their body, and their surroundings. This natural and healthy desire for control can lead to power struggles, as children quickly figure out that one way to feel in charge is by refusing to do something they know their parents want them to do. And for better or worse, learning to use the potty is way up there on most children's list of what they really, really, really want their child to do. And truly, children really quickly pick up on that. So remember, it's important to approach toilet training matter of factly and without a lot of emotion. If you show anger or disappointment when it's not going well, or overwhelming joy when it is, it lets your child know this is something you want them to do very badly. So for a child, refusing to do it becomes a very, very, very powerful way that they can feel in control. The more emotional you are, the more it shows your child how much and how it matters to you if they use the potty. These power struggles sometimes lead to children trying to regain control over their bodies, and they might withhold going to the bathroom, so urinating or having a bowel movement. And this can create physical problems like constipation. So if you're starting to see power struggles developing over potty training, it might be time to take the pressure off. Stop talking about potty training or doing anything about it for a while until your child shows signs of readiness and interest again. So just try to think of this as another skill that you're helping your child learn. And it's very important not to force them to use the potty because it can cause intense power struggles. Another big question we get asked is, should we reward our child or not reward our child? Many parents wonder about offering rewards for using the potty, a sticker, a little treat, a little toy every time their child is successful. Although these things and these kind of rewards may encourage progress in the short run, the concern is that for some children, the pressure of success in the form of reward creates anxiety or feelings of failure when they have a very normal accident. The other risk is that the use of the rewards for toileting can lead children to expect rewards for doing almost anything, brushing their teeth, finishing a meal, etc. When parents are matter of fact about potty training and don't make a big deal about it, children are more likely to follow their own internal desire to reach this important milestone. Just remember to reach out to your child's healthcare provider with questions or concerns about potty training. Occasionally, children have physical issues that make potty training more difficult, so a checkup is always a good idea. You may also want to sit down with a child development specialist who can help you figure out the challenges around potty training and what might be going on with your individual child, and they can help you individually. And they might help you think of strategies to help you become and your child more successful at the process. Some references that were used for this presentation were looking at the American Academy of Pediatrics and 0to3.org. You may look at either of those websites if that might help you. Thank you so much. Again, this was the Office of Early Childhood.